heart disease. It's the #1 cause of death in the world, and our next company has a mission to change that. They're working with other powerful digital health companies in the industry to annihilate heart attacks and strokes, which is a bold, bold move, and one that they are utilizing digital health to do. I'd like to welcome Omron CEO Randy Kellogg to the stage for a look at how the power of collaboration is hitting healthcare where it matters most. Thank you.
Thank you. I like the word annihilate. That's good. Hi, everyone. I'm Randy Kellogg. This is a very important year for us here at CES. Over at our booth, or downstairs at our booth, we're showing our new mission, and we're also showing our new breakthrough technology that's very important for us, it's very important for the industry, and it's most important for heart health issues. If you've heard me speak before, you've heard me say that 1 out of 3 of you in this audience is going to die from cardiovascular disease. That's a startling statistic, and unfortunately, the magnitude of it has gotten even worse. You may have recently seen new hypertension guidelines announced. With those guidelines, now 103 million US citizens are hypertensive. That's nearly 50% of all adults. So now I can say 1 out of 2 of you is likely hypertensive. These new guidelines were put out by the American Heart Association, the American College of Cardiology. They're really about making people more aware so that they can take action and take it sooner. We know we need to act. We all know that there are lives lost and lives changed by heart disease. At Omron Healthcare, we're trying to answer that call. We're answering it by evolving our mission, investing in breakthrough innovation, and developing powerful new partnerships that help us fuel our innovation and growth. You can see some of that work if you go downstairs at our booth here at CES. Partnerships are our new direction. It's the direction we've taken recently at Omron Healthcare. Our partnerships are now producing breakthroughs for the global heart health market. And one of our breakthroughs innovation is this device on my wrist, which you can see a picture of there. That is our wrist blood pressure monitor, and I'm going to tell you a little bit more about that very soon. First, let me tell you a little bit about Omron Healthcare and how we're bringing innovation to market. We're the global market leader in blood pressure monitoring and in personal heart health technology. We've been doing this for 40 years. Over a year ago, we made a big decision to change our mission. Our mission is now called Going for Zero. We want to eliminate heart attack and stroke. To achieve that, we've upgraded our focus, not just about revolutionizing blood pressure monitors and wellness devices, but also by committing our resources to move the needle in heart health. And by move the needle, I'm not talking about our sales. I'm talking about lives saved, and we like to say we're putting our money where our mission is. As a company with a long heritage in heart health, we decided it's time to measure ourselves by the difference we can make in reducing heart disease. We know that that's a big goal, we know that it's a bold goal, but we believe it's very much possible. We all know that heart disease is the #1 killer globally. We know that it takes a terrible human toll. At Omron, we also know one other thing. We don't have to accept that as the norm. We believe that if we attack heart disease, we can eradicate it. And we know we can't do it alone. I've spent the last 10 years of my career working on heart health because it's something that's personal to me and it affects every one of us. I've seen the industry make great strides and then fall back and stall on making progress. The continued grim statistics of heart disease tell us that we're not where we want to be, nor are we where we should be to make a real difference in fighting heart disease. Knowing your blood pressure is vital to understanding your risk for heart disease. Acting on that data empowers you to reduce that risk. Studies show that for those with hypertension, regular monitoring and sharing that information with your physician leads to much better compliance and much better outcomes. And all the latest technology makes that possible. We are on a journey to better heart health, from improved pre-diagnosis to better communications between physicians and physicians and consumers. For us, it begins with our new app, which we're launching next month, called Omron Connect. Our new app syncs your blood pressure monitor. It brings all your heart health data together so that it can be stored, tracked, and shared with your doctor. The ability to share represents an advancement in the doctor-patient relationship. That's a key partnership that we see in Going for Zero. Patients can be more committed knowing that that data that's coming in is going to their doctor and it's from a trusted medical device. Doctors gain more insights and by seeing this important data, and that sense of partnership leads to better treatment and better outcomes. Let's talk a little bit more about why doctors will trust that data. I'm sure you've heard about that today. Our blood pressure monitors are FDA cleared and they're clinically validated. We make medical devices and none of our products come to market without the clinical validation. We have a wide range of products, blood pressure monitors and heart health monitors to serve the needs and preferences of a large population, 103 million, that want to monitor their blood pressure or should monitor their blood pressure at home. Yet there have been some needs in the market and in the category that have not been addressed. The innovations we're showing here at CES are one of the ways we're working with breakthroughs to meet those needs. We're preparing to introduce the first wearable wrist blood pressure monitor. That's that innovation I showed you a little bit before. It looks like a watch, but it's really a blood pressure monitor. You press a button, hold it over your heart, and it will take your blood pressure and it will take it accurately. It is a medical device. We won't bring it to market until we have FDA clearance. Over the past year, we've been partnering with medical researchers to make significant advancements over a prototype that we showed here last year. We've also worked hard to make sure the design, the accuracy, the comfort, and the technology on the prototype on this device is much better than before. We've conducted real-world tests, we've put it on users, we've put them out there, we've had them give us feedback, and the result is the breakthrough wrist blood pressure monitor that we have now. It's very stylish, it's truly wearable, and one of the advancements we found from talking to consumers was a new cuff design that allowed it to work for more consumers than ever before. We call it Omron Heart Guide, and we continue to redefine the blood pressure marketing experience with these kinds of devices. We make it in 3 sizes because not everybody's wrist is the same size. So we want it to fit and we want it to be comfortable for everyone. You can even program this device to take a blood pressure reading while you're sleeping, which is the very important time because most heart attacks and strokes happen while you're sleeping or just before you wake up. The wearable monitor is a vital health tool for those who have heart disease and are in the hypertension danger zone. It's also very good for those early adopters who want access to all their heart health information at any time. Most importantly, it can help reduce cardiac events by making sure the information is seen early and that data can be watched much better. That's what Going for Zero is all about. So that's another kind of partnership that we've been investing in, a partnership between us and the consumers to encourage them to change their behavior, monitor their blood pressure, have better heart health, and we listen to their feedback and we keep innovating based upon that feedback. Another kind of partnership is one between us and other companies. We're constantly looking at the market, see what's out there, what technologies are there, and seeing how we can combine our technology with someone else's technology in pursuit of Going for Zero. We're developing exciting new technology with new partners right now to provide individuals and their doctors with an even more complete picture of their heart health. Atrial fibrillation. You've probably heard a lot about it lately. It's a pressing need in the category. It's diagnosed by an EKG. So Omron is creating the world's first blood pressure monitor for use at home that also measures EKG. Up to 6 million people have AFib. These people are at a 5 times greater risk of stroke than those without the condition. This is a partnership with Lifecore. It's led to a breakthrough in this home blood pressure monitor with EKG. It's a first. The device will come to market this year with FDA clearance, and the BP data and EKG data can be stored, tracked, and shared with your physician, which is very important, especially with the EKG. Omron's living the power of partnership, and we're taking that even further with other partners who believe in Going for Zero. We're collaborating with Healthcore to train youth on CPR so that we can put more first-line providers in place. We are working with Amazon and have just launched our first Alexa skill that helps with heart health around the world, or around the US anyways. We've launched an awareness campaign. We're on news media. We're speaking at meetings across the country. And we're working with people like the American Heart Association. And if you come by our booth and you sign our pledge wall, we're giving one monitor for every pledge we get to the American Heart Association to put in the hands of people that need it. So we're all in now. We want you to be part of Going for Zero mission. If you're working on heart health and want to make strides, if you don't accept heart disease as normal, if you believe Going for Zero is important, we want to hear from you. When it comes to heart health, we must combine our strength and our will for change. We must act, we must reach out, we must form partnerships, but most importantly, we must take care of our hearts. Thank you.